Hey, this the 3 facts about T-cell lymphoproliferative disorder today. We're diving into T-cell lymphoproliferative disorder, a rare disease where the immune system's own soldiers, T-cells, multiply out of control. It's a condition that recently made headlines when singer Halsey revealed her diagnosis alongside lupus. Her openness has turned a complex medical issue into a story of resilience, shining a light on what it means to live with such a diagnosis. So what are T-cells? And why does their overproduction cause chaos? We'll break down the science, the symptoms, and the human side of this disorder. By understanding stories like Halsey's, we can become more empathetic and informed. Let's dive in. Imagine your immune system as a highly trained and organized army, constantly patrolling and ready to defend against any threat. Within this army, T-cells are the elite special forces, meticulously trained to identify and neutralize specific threats, like viruses or cancerous cells. They are the body's precision strike force. Normally, the body maintains a delicate balance, tightly controlling how many T-cells are produced in the bone marrow, and when they naturally die off, ensuring the immune response is proportionate and doesn't become self-destructive. However, in T-cell lymphoproliferative disorders, this crucial control mechanism malfunctions and fails. The body starts producing an excessive amount of T-cells, far beyond what's needed, or these cells simply refuse to die when they should, leading to an overpopulation. These excess T-cells can accumulate and build up in various organs, most commonly in the lymph nodes, causing them to swell and become enlarged. Spleen, liver, and even the skin. This abnormal accumulation disrupts the normal function of these vital organs. The disorder isn't a single, well-defined disease. Instead, it's a complex group of related conditions. These conditions range from slow-growing, relatively benign forms to highly aggressive and rapidly progressing types. At the heart of the problem lies a loss of genetic control over T-cell production and regulation. This loss of control is often triggered by genetic mutations, or in some cases by as yet unknown factors. The result is an unchecked and ever-growing army of T-cells spiraling out of control. These excess T-cells are essentially clones of a single, malfunctioning original cell. Instead of providing protection, these rogue T-cells begin to cause damage to the body's own tissues and organs. This internal rebellion within the immune system can lead to a range of serious and potentially life-threatening health issues. Patients may experience a wide range of symptoms, depending on which organs are affected and the specific type of T-cell disorder. Diagnosis and treatment of these disorders can be particularly challenging, requiring careful evaluation and monitoring. Effective management often requires a personalized approach, tailored to the individual patient's specific condition and needs. Ultimately, it's a fundamental betrayal by the body's own defenders, highlighting the delicate balance required for a healthy immune system. T-cell lymphoproliferative disorders. These conditions represent a complex group of diseases affecting the T-cells, a critical component of our immune system. Are medical chameleons, often presenting in ways that obscure their true nature. Their symptoms mimic many other illnesses, making them difficult to identify initially. This can lead to delays in diagnosis and appropriate treatment. Common signs include persistent fevers, which can come and go without an obvious cause. Night sweats, often drenching and disruptive to sleep, are another frequent indicator. Unexplained weight loss and fatigue, a profound sense of tiredness that doesn't improve with rest, are also common. These are classic signs of an immune system in overdrive, working in a dysregulated manner. Swollen lymph nodes and an enlarged spleen are also frequent, indicating the body's attempt to fight off a perceived threat. This occurs as these organs fill with excess T-cells, contributing to their enlargement. Ironically, having too many immune cells, a condition known as T-cell proliferation, can make you more vulnerable to infections, as the immune system's resources are misdirected. This is because the system is unbalanced, leaving it less effective at fighting off real threats. Skin involvement is common, manifesting in various ways. This can include rashes or lesions that can be mistaken for eczema or psoriasis, further complicating the diagnostic process. Diagnosis is tricky, often requiring a high degree of clinical suspicion. Blood tests to assess the number and function of immune cells, biopsies to examine affected tissues under a microscope, and advanced lab techniques like flow cytometry are needed to pinpoint the exact disorder and its specific characteristics. Each case is unique, presenting its own set of challenges, therefore requiring careful detective work to get the right answer and guide appropriate treatment strategies. The diversity of symptoms makes early diagnosis difficult, often leading to misdiagnosis or delayed treatment. But awareness is key, both for patients and healthcare professionals. It's a puzzle that demands attention to every clue and a collaborative approach to solve. For years, T-cell lymphoproliferative disorders, a group of rare conditions affecting the body's immune cells, were little known, often overlooked in medical research and clinical practice, leaving patients isolated and misunderstood, struggling to find answers and support in a world that didn't recognize their condition. That changed when Halsey, the acclaimed musician, shared her diagnosis publicly, bravely stepping into the spotlight to reveal her personal health journey, giving a face and voice to the struggle, transforming her experience into a powerful message of awareness and hope. Her openness sparked global conversations, igniting discussions about rare diseases and chronic illnesses across various platforms, making these rare diseases visible and relatable, bringing them out of the shadows and into the mainstream consciousness. The Halsey effect has driven awareness, significantly increasing public knowledge and understanding of these conditions, encouraged earlier diagnoses, prompting individuals to seek medical attention and potentially shortening the diagnostic journey, and inspired support for research, galvanizing efforts to find better treatments and ultimately, cures. Patient advocacy groups have seen a surge, experiencing a remarkable increase in interest and resources, enabling them to expand their reach and impact. Halsey's story reframes chronic illness, not just as suffering, a narrative of pain and limitation, but as resilience and creativity, highlighting the strength and ingenuity that can emerge from adversity. She shows that you can be both vulnerable and strong, capable of expressing your deepest fears while simultaneously commanding attention and respect, patient and powerhouse, navigating the challenges of illness while continuing to achieve extraordinary things. Her advocacy empowers others, inspiring countless individuals to share their stories and seek help, fostering a sense of community and reducing the stigma associated with chronic illness. By speaking out, Halsey has united a community, connecting patients, families, and healthcare professionals in a shared mission and pushed for progress, accelerating the pace of research and improving the lives of those affected. One person's vulnerability, one courageous act of sharing, can truly become a source of strength for many, creating a ripple effect of hope, understanding, and positive change. We've explored the science, the symptoms, and the impact of sharing personal stories like Halsey's. Living with a rare disease is tough, but no one should face it alone. We can all help. By spreading awareness, supporting research, and showing empathy. Every bit of understanding and support makes a difference. Thanks for joining me today. If you found this helpful, please like and subscribe for more health deep dives. Stay curious, stay compassionate, and see you next time.